COVID-19 has caused human mobility to come to a standstill amidst a new wave of infections, while international migration continues to fall sharply and has impacted the economy on a global scale. Dimitrios G. Papadimitriou, a president emeritus of the Migration Policy Institute, said that we're approaching 1.5 million deaths around the world, making this pandemic the deadliest pandemic in over 100 years. In the height of the first phase, almost all countries around the world closed their borders, grounding mobility to a halt. Even now, over 70 countries around the world still have their borders closed. In those countries who allowed tentative reopenings of borders, like Europe, migration and movement had begun to flow again. However, in the last month, Europe has been hit harder than even the US in terms of deaths and hospitalizations. That means something did not work out, which includes mutations of the virus, a fact that troubles epidemiologists. The trouble that all countries now face is how to reopen the country and reopen borders while protecting themselves and the population. Vicente Calderon, editor of TijuanaPress.com, said that Tijuana is the definition of migration, and the pandemic has largely impacted migration to and through Tijuana and into the US. Currently, there are thousands of people from Central America and Mexico waiting in Mexico for their asylum request to the US due to a policy called Migration Protection Protocols. The pandemic has been a great excuse for the Trump administration's severe migration restrictions to remain in place. Krishna Raj Rao, an investigative journalist in India, said that 1 in 10 Indians is a migrant worker or a migrant entrepreneur who travels to Mumbai for work and then travel back to their village. So India is a population that is constantly on the move. Though COVID has hit them hard, he said that the South Asian countries seem to have a low mortality rate compared to the rest of the world. He added that 50 to 60% of the population of Mumbai lives closely packed together in slums. Therefore, social distancing is hardly practiced or can even be practiced at all. So there's speculation on how and why the coronavirus hasn't ravaged most of India. Rao touched upon underreporting could be one of the reasons, but he doesn't see the bodies or deaths occurring as they should be given the lifestyle in India. While there were many deaths in the beginning of the pandemic, there hasn't been so many since May. His belief, along with most Indians, widely believe that the virus has been taken much more seriously than needed. There's speculation that a natural immunity has occurred or people in that part of the world are better equipped to handle it.